Welcome to Ovary-Acting, your ecosystem for all things women, where we take your health and wellness seriously, but ourselves, not so much. I'm your host, Dr. Jennifer Ashby, clinician, acupuncturist, researcher, and your guide through this female journey. Why are we doing this podcast? Because you deserve a life revolution, one where you feel informed and empowered, but also where we can discuss and laugh at the ridiculousness of it all. This is a place where we call out the elephant in the room. So if you want some smart talk with a wink, stick around because we're about ready to shake things up. Today is going to be a unique episode where I'm going to talk about my journey through brain surgery. I am 5 weeks out. 5 weeks? Is that right? 5 weeks out. Wow. 5 weeks and 2 days, but who's counting? And I just kind of want to bring you on this journey with me a little bit. So I'm both the interviewer and interviewee today. I want to start out by giving you a little understanding of why I did this. I have a congenital malformation called a Chiari Malformation type 1. There are 4 kinds. I have the most benign form, thank goodness. And it was progressive. My brain was pushing against my occiput. My cerebellum was collapsing into my occiput, and the cerebral tonsils were descending into my neck. The right side was 17 millimeters, and it was starting to it was blocking my cerebral spinal fluid. So I had a very particular, what's called a Chiari kind of headache. I had tremendous fullness on the side of my head. I had dizziness. I couldn't do impact sports. I couldn't jog anymore. I couldn't be on a trampoline. I had to be careful. Anyway, it was time to correct it. We corrected it. I had a wonderful surgeon, Dr. Tarun Arora. And the surgery itself included a craniotomy, a duraplasty where they cut open the outside of your brain. They let my cerebellum expand. They patched it with another part of my dura. So I have 2 scars. The top one's probably about that big and the bottom one's probably about that big. And then it was a laminectomy of C1 to allow cerebral spinal fluid to flow. So it's a very invasive surgery, not a complicated surgery for a brain surgeon, but an invasive surgery. So healing from the actual surgical site was actually the easiest part of this whole process. So when I decided to do this, there was a whole bunch of stuff I needed to do. I needed to finish the energy prescription, my shameless plug for my book for menopause and perimenopause. Pre-order, actually, it comes out October 19th. Super excited about this. May this change all your freaking lives. And I was finishing the book. I was starting Ovary-Acting, so I had something to do while I'm recovering. I had talks to give. There were some my youngest turned 21, my middle one turned 28. There were just things I wanted to do. Ollie and I were having our 1-year wedding anniversary party, and there were things that I wanted to complete. And then after June, I had nothing planned. So July 15th, I have this surgery. I employed all the things that I write about. Everything that I suggest in this book is what I employed to prepare myself for surgery. I also went into hypnotherapy because I learned that fear and terror and excitement are kind of on the same intensity scale. And I wanted to learn how to turn my fear of brain surgery into excitement about the possibilities. I am very protective of my head. I've had a lot of head trauma, and I'm protective of my intellect. I'm protective of the physicality of my head. I'm protective of being the master of my thoughts. And so brain surgery was overwhelmingly daunting for me. So in this preparation, this is how I led myself up to the moment. The morning of surgery, everything that I had learned, everything that I had practiced. The diet, making sure I was hydrating, practicing my breath work, making sure I was sleeping enough and well, moving my body, both like cardio and also doing some strength training with the brilliant Brianna Stockton. And, making sure that my gut health was big, because a huge part of healing and our immune system and our ability to heal has to do with our gut microbiome. Making sure that I was experiencing joy and awe in my life, and really practicing all those tools that I developed to not embody the stress of brain surgery. And then the morning of, I was a fucking mess. I mean, I was a mess. And so here's the story, the abridged version. We got to the hospital, and Ollie went to go park the car, and I went in, and we were 8 minutes late. It was 6:30 in the morning. Surgery wasn't until 8:30. My kids weren't there yet. And so I said, I'm here for this. They said, okay, go to this elevator right now, go up to this floor. So I said, well, my husband, they're like, just go check in with them. So I went up there. They're like, great, take your clothes off, put this on. And I was on a gurney, and this was all happening before anyone was with me. Like, kids and my husband were not yet there. And Nana Missy. So, so I'm on a bed on a gurney, and I'm in the hospital gown, and in walks a very tall, gray-haired gentleman whose energy I liked immediately. And he said, hi, I'm your anesthesiologist. How you doing? And I told him, all my tools are not working. My anxiety is through the roof, and I don't want to bring this energy into surgery. I've worked so hard. I don't want it in the OR, but I'm not winning. I'm not winning at controlling it. And I protect my head enormously. It's one of the things that I've always been able to rely on in my whole life to get me out of sticky situations, to promote me in my field, to help me figure out anything, like my head, my intellect, my intuition, like all of it. It's weird to be having brain surgery, and with head trauma, like I'm feeling too vulnerable. And he looked at me and he said, I think I know exactly what you need. Thank you so much for sharing all that with me. And he turned to his two students and nodded. And I just closed my eyes and held my little head for a moment. I opened my eyes, and my children were in the room. And I said, okay, guys, how soon till we get started? And they said, oh, Mama, you're done. I was already done with surgery. I thank that anesthesiologist at UCSF and his team. Oh my goodness, that's just the greatest gift they could have given me. And so the first thing out of my mouth to my children was, shut the fuck up. That's the best news I have ever heard. And in the next moment, what happened was I realized that there were equal realities. In parallel universes, there were 3 possible outcomes. 1, I died. 2, I had a stroke or some other event that would render me not as able-bodied as I am now and dependent on my loved ones. Or 3, everything came out okay. And I realized in that moment that I had the privilege of having everything come out okay. And my heart burst open into a million pieces of gratitude that has not left me, and I hope it never leaves me. So grateful that this reality was my reality. I also realized in that moment that it wasn't that I was afraid to die. I did not want to leave my children 2 years after their father had died. I didn't want to leave them without another parent. And again, my heart burst open with gratitude. I didn't want to leave my husband. We have stuff to do. This is a new marriage. We have plans. And the fact that we might actually be able to fulfill those plans, that we get to sit around and giggle and create and be in nature and do the things we do, like none of that was lost on me. And then the healing came. I was in the hospital for 5 days. I was on a lot of drugs. I was on Dilaudid. I was on Oxy. I was on Baclofen. I was on Neurontin. I was on heparin. Oh my gosh, I was just on a whole bunch of stuff. And I'm a pretty happy high person. And so I was in there for 5 days. My kids came every day. My husband stayed with me every day. And it was uncomfortable, to say the least. We did a very good job of keeping my pain under control. And the 5th day I was ready to go home. I was not ready to go home prior to that. One thing they said to me was, make sure that you keep your bowel movements moving. But I was high. Keep that in mind. So I walked myself out of the hospital on day 5 with my husband, and he had already pulled the car up, and he gets me in the car and he goes to move. And I said, stop the car. Honey, we get to go home together. Like, we get to do this. We actually get to drive home together as 2 able-bodied people. I think it's really important that we take a moment to acknowledge that. And we did. But then driving home, we were on the bridge. Remember, I'm still on a cocktail of drugs. And I'm like, oh my God, look where the hell we get to live. I live in the Bay Area, Golden Gate Bridge. And then we got home, and the children were on the porch with their significant others, and the garden looked like it was thriving, full of colors. And before I got out of the car, I just stopped and I realized, like, wow, this is where I get to come home to and the people that I get to do this with. So there was so much gratitude. It was amazing. My community showed up like crazy. They were here every day. We had dinners delivered, I think, every night for 3 weeks. I had very close friends come by and bathe me and feed me and massage me and give me acupuncture and love me and just be near. And my family, my kids that showed up with schedules. My daughter did this amazing schedule of this ridiculous amount of pills I had to take. And they hung out with me and they did art for me and they talked to me and they took care of me. And my husband, who was here every moment of all of it, doing everything. He had to pick up all the pieces that we normally do together. But then I was on those pharmaceuticals for a little bit too long. And the happy high went away. And I just kept saying, I'm too high. I'm too high. I don't want to be this high. It seemed a little early to maybe go down on those drugs. And I hadn't paid attention to keeping my bowel movements moving. And I ended up with a fecal impaction and in the ER. What happened is 2 days prior, my stomach was just bloating. I was so big. I looked like I was 6 months, 7 months pregnant, and I knew what it was. And in our best attempts to get things moving, it wasn't working. So I ended up with a fever, so we had to go to the ER. And they scanned me, and they gave me a CT scan, and they said, wow, you are astoundingly constipated. You can do this here or do this at home. It'll be the same. So, of course, we went home, and now I also had a UTI, and I ended up with all of these drugs and antibiotics. And the night after, I think we got out of the ED like at 3 a.m. And that night at home, I was sitting there with 2 handfuls of pharmaceuticals, which I don't normally take. And my body did not want to take them. It didn't want to take them at all. And I would take a bite of Dal that my dear friend Shauna made, and then I'd get 2 more pills. And it took me like over an hour to get all these meds in. And the next morning I woke up and I said, no more drugs, no more medications. I need to land back in my body. I need to figure out what I need. My body did not want to take those antibiotics. I mean, it was such a loud message. So I spent 36 hours with nothing. And I was like, okay, so I developed like this modified schedule, and there was nobody really, there was no quarterback managing my polypharmacy or all these medications, all these pills at this time. So I stopped. I got back that they couldn't culture anything in my urine, so no more antibiotics, and that they couldn't culture anything in my blood, so I hadn't gone septic, so I didn't have to take the antibiotics. And I started cutting back the OxyContin and the baclofen and the gabapentin. And I went into a really, really, really dark place where I felt offended by the level of care I was getting. Totally ridiculous. I felt offended by everything. And I recognized this as drug detox. I was being unkind. I was being sharp-tongued. And I felt really, really justified in it. So in one juicy evening where it all where inside my head I exploded, I locked myself in my room for 3.5 days and got off the Oxy, which I'd only been on at that point for 2.5 weeks. And although I'm really grateful for having that medication, it is evil. My body wanted it. My body wanted me to take more. At night, there was a voice in my head going, "You're allowed to take 2 at night. Go ahead and double the dose." So when I recognized this behavior that I had as narcotic induced, I locked myself in my room for 3.5 days. And although it wasn't terrible, I wasn't shaking and vomiting. I was going through a whole psychological song and dance, and I had the sweats, and I just needed to be alone until I pulled out the other side of it. I felt better in 2 days. I kind of came out in 3 days. And then it took several days afterwards. Once I felt that I had conquered the Oxy, then I had to get off the baclofen muscle relaxer. And I also needed to see, did I need any of these things? But I was healing. I'm still on gabapentin. I thought, I'm only on 400 milligrams. I have patients that are on 16, 18, 2,000 milligrams, 1,600, 1,800, 2,000 milligrams. And I'm like, 400? No problem. I'll stop. And oh my Lord, I got so sick. So I'm week at a time titrating off that. And it makes me a little dopey. It makes me, sleepy. But it does help with the nerve pain as my nerves regenerate. My scars are healing wonderfully. They only shaved off a strip of my hair, which is growing back. That's a weird thing. So as they tucked my skin in to do this amazing stitching, part of the skin they tuck in is part of this hair that was shaved. So that hair still grows, and it would grow poking into my incision, which was relentless and really annoying really relentless and annoying pain for about a week and a half, 2 weeks. Anyway, I am healing. I think I am doing great. I feel like my brain will come back in full force when I'm off this gabapentin. I had no idea that my actual skull, the brain surgery and its incisions, were going to be the easiest part of this surgery. I did not plan for that. I planned for physical recovery. I planned for increased immune system. I planned for, nourishing my blood and chi and all the things that we do in East Asian medicine. I focused it on my kidneys and my brain, which are the sea of marrow in East Asian medicine. But what I didn't plan for was the side effects of the pharmaceuticals, both physically and emotionally, and my lack of capacity for grace when I was reducing those medications. Yeah, that the hardest part was the pharmacological drugs that I needed at a time, getting off of them. So a bit of a warning to you all. The good news is I'm still married and my children still love me. I don't think I lost a single friend, but I was challenging. I'm going to own it. And then there's another part that came out of this. Somewhere in my algorithm, because there was so little I could do, so many hours on this couch watching that TV, sleeping, watching, and doom scrolling. But somewhere in my algorithm, the Stoics and Ryan Holiday got into my feed, and I got into the Stoics. Ironic that Odysseus should come out right now, and there's all this talk about Stoicism and Homer's Odyssey. But yeah, I've gotten into the Stoics. So strange. It's so male-focused, patriarchal, and yet such good guidelines for living. So Stoicism is based on 4 virtues: wisdom, temperance, justice. What is it? Oh my God, this is where my brain is. Wisdom, temperance, justice, and what is the 4th one that I'm missing? Oh my God, here I am. I can't even think of it right now. Okay, so this is when I say that my brain is not yet tracking, this is what I'm talking about. As a matter of fact, I'm going to look it up, because how could I talk about Stoicism and not be able to tell you what that is? So hold on, I can't type. Oh, courage, duh. Wisdom, courage, justice, and temperance. So Ryan Holiday wrote The Daily Stoic, which my husband and I read every day now. And he wrote the book, The Obstacle is the Way, which has kind of been on my radar for a long time. When I first learned about the book, The Obstacle is the Way, it scared the crap out of me. I was like, I got to face what to what. And now at this point in my life, it is just such a welcomed concept and actual endeavor for me. So wisdom, courage, justice, and temperance, not just as a philosophical theory, but it's actually like a roadmap for living. And I'm not really into astrology. I don't know anything about astrology, but I've been told over and over again that you are such a Capricorn, and I am. I'm a fire horse Capricorn. I like practicality. I like systems. I like order. I like practical ways of doing things, logical, practical ways of doing things. So what Stoicism is doing for me at this point in my recovery is it's giving me kind of a plan. It's giving me a path. So what I've found is that I am also struggling with, who do I want to be when I grow up? Ovary-Acting, I planned as something I could do as I take 6 months off of work into recovery, as a creative thing to do and a way of educating myself and my listeners. Super stoked about that. My work at UCSF, super stoked about that. I get to do really cool shit there. I love my work there, but I'm only there 50%. I closed my private practice at the end of April after 30 years. And I'm just I've got this book, right? Shameless plug, coming out October 19th, The Energy Prescription, Ancient Wisdom and Modern Science for Thriving Through Menopause, Wiley Publishing. But I'm not really sure what is the best way for me to spend my energy with the unique skill set and knowledge that I have is at this age of 59 3/4 until retirement. So, and having gone through the emotional component of getting off narcotics and behaviors that I'm not proud of, although ultimately very proud of myself for acknowledging it, taking it on myself, and working on recovery from it. I'm actually entering into therapy, a Stoicism therapy that I'm going to be starting today, actually. Super excited about that. It's like cognitive behavioral therapy and Stoicism. So I kind of have someone working with me on this new journey. But what I find is I am reevaluating everything. I had been warned that brain surgery, a cancer diagnosis, heart surgery, I'm sure I'm leaving things out, lead to a spiritual crisis and awakening for many. Even though I do all this work with patients over all these years, I don't think I ever knew what that actually meant. And I think I do now. I'm in it. I'm experiencing it. So I am facing my own life patterns, positive and the ones that are not as desirable, and I'm taking it all head on to figure out who I'm going to be, not just in work, but in life from this point forward. So that's what I want to share with you. This has been my journey with brain surgery, and the journey is not done. I feel like we just got through the acute part, and the lasting effects are going to unravel over the next months, maybe even years. So Stoicism is part of that. Doing my own deep work. I am a Hoffman process graduate. I am employing the skills that I learned from them 7 years ago on the daily. Yeah, I'm reevaluating life and all of its juiciness in every way that it's presented itself to me, holding on to gratitude, thanking my own body for its ability, loving the people that are so near to me, facing my own internal monsters and patterns, and finding new ways of approaching life that speak to me now that wouldn't have spoken to me 2 years ago. I appreciate your time. This is much longer than I thought it was going to be. Thanks for following me on this journey. And if you have had journeys similar, please reach out. There's so many ways of getting a hold of me. If you want to speak on Ovary-Acting, about experiences you've had, please reach out to me. If you know other people, this is a conversation of life that I hope goes on between all of us for a long time. So, Shabbat Shalom. May you all be well. Until next time, thanks for joining me.